So conditions like hypertension, diabetes, high cholesterol, and obesity increase your risk for Alzheimer's. Reduced blood flow and oxygen supply to the brain exacerbate neural chain damage. Head trauma. A history of head trauma or injury or brain injury has been linked to increased risks of Alzheimer's later in life. Sleep disturbances. Chronic sleep deprivation or disturbances like sleep apnea can impair the brain's ability to clear the beta amyloid during rest periods. Dietary habits. Diets that are high in saturated fats, sugars, and processed foods are linked to increasing dementia risks. Antioxidant-rich diets, such as the Mediterranean diet, are associated with better cognitive function. Lack of physical activity. Sedentary lifestyles are associated with poor cardiovascular health and therefore brain health, which contribute to the risk of dementia. Environmental factors. So exposures to toxins, long-term exposures to neurotoxic substances like heavy metals, aluminum or lead, or pesticides may contribute to brain damage and Alzheimer's risk. Educational and cognitive engagements are also affected. So low levels of formal education have been linked to increased risk due to lower cognitive reserve. Cognitive reserve refers to the brain's ability to compensate for damage by using alternate neural pathways. All right, so what that's saying is when we're developing and we're young, the more your brain is developed because you're well read, because you're, we'll say, higher functioning, or your level of education, which caused your brain to keep thinking over and over again, it plays a role. That is something I never even thought about or even heard before I did this deep dive, right? So that's something that is interesting angle. Chronic inflammation and immunological factors.